right away. That's why there's sometimes a delay, by the way. Low back release, you can't afford to ignore. Welcome, everybody. It's Jason Barlow, RMT, and I'm here today as your therapist and as your coach to help you transform your stress, your tension, and pain into health, happiness, and vitality. So this week, I'm focusing in once again on the pelvis, but tying it into how it influences your lower back, because we have to always be trying to find the root or origin of your pain. That's essentially what I strive to do as your therapist and certainly as your coach. And I know many people that have been to multiple therapies and never truly found the origin of their pain. And that's something I continue to chase for my patients, certainly, that come in. And for those of you that aren't necessarily a patient directly, but helping you to find the origin of your pain is my goal. So hopefully you're able to join me each week and dive into some of these elements, because maybe it helps you to just identify the origin of your particular pain or symptom that's going on. So short story for you. 2008, I will always remember, we had 4 boys aged 4 and under. Our twins had just arrived, and these are all boys, remember. Rambunctious boys, full of energy, love to eat boys. And so at that stage, aged 4 and under, I was doing a lot of bending over. Now, at the time, I was kind of just getting into, I think that would have been just before even starting CrossFit. But where I'm trying to go with this is I know what low back pain feels like. I'll still get flare-ups, but with what I'm suggesting with you, and surrounding yourself with professionals that are going to support your program, there is a way to help keep it under control and potentially completely eliminate it too. And so what I'm sharing with you today gets into how we can center in around especially the SI joint. The SI joint is right at the base of the spine, with the sacrum meeting with the iliac crest or the ilium, and here at the base is the ischium. This forms your pelvis. There's 2 sides to the pelvis. They're 2 separate bones, and each one is known as a hemipelvis. Now, as a father of 4 boys, with all that bending that I was doing, that was putting a lot of stress into this region. Now, I've remembered 2008 to 2010, there was definitely a hiatus where I wasn't doing any particular training. I was just busy as a dad and busy doing my work. And with the nature of my work, what am I doing? I'm bending over the table, working on other people's bodies. And so this area was taking on a lot of stress. And clearly, I wasn't doing enough stretching, and I wasn't doing it. There's reasons for it. And this is what I'm trying to empower and share with you. As I've been through those struggles and strifes, and low back pain especially, this is what I've found to help relieve that pain for me. So here's what I'm sharing with you today. The pelvis is at the base of the spine. Every time that you are walking, the legs are swinging like pendulums. So the health and integrity of this entire region is influencing what's happening, therefore, in the spine and continuing up the back to the base of the neck. So what we've got to understand here is there's certainly causes that can trigger SI pain, especially people who've got gut inflammation, especially to the kidneys, to the bladder, to the colon. Any gut irritation that's going on can actually manifest as pain into that lower region. Why? Because of somatovisceral reflexes. That's basically just a very cool word that we use to tell you that there's actually triggers that happen between the organs that are sitting in that reservoir of your pelvis, reservoir of your abdominal cavity, and they actually are communicating. They're on the same channels as certain muscles that stabilize and support your spine and your pelvis. So when you get inflammation in the gut, you might not even get gut symptoms. You may be getting low back pain as a symptom from your body to alert you of the fact that there is an imbalance in your gut. And that's where going down the avenue of one of your 4 controls, remember, is food. Looking at foods that are anti-inflammatory, right? There are foods right now that you're ingesting potentially that are pro-inflammatory. They're creating more inflammation in your body, and we're trying to calm that system down. More about that later. Or other causes can be any surgery that we've had. Anytime we are experiencing any history of surgery or we've had surgery, that is a disruption to the musculoskeletal system, scar tissue formation, trigger points, and these can also create symptoms into that lower back. And this can be any area. Right now I'm focusing on the lower back. So we've had inflammation, we've had surgery, we've had any history of low back pain or trauma or injuries. Those are considerations that we've got to factor in. Now, as I was saying, when you're walking, legs are swinging like pendulums. You have this pretty cool system in your body, in your core, as we call it, called your inner unit. Your inner unit is made up of your diaphragm, your transversus abdominis muscle, your pelvic floor muscles, and also the deep stabilizers of the spine. Now, when you are walking, when you are bending, essentially loading this area, ideally that inner unit should be firing, that is engaging to stabilize this region. And it essentially does that through what we call a principle of the Nutcracker Effect. This is something I learned through Paul Chek and the Chek Institute. The Nutcracker Effect goes like this. Imagine that the two sides of your pelvis are like the jaws of the nutcracker. The nut itself is the sacrum, and the hinge from which the jaws communicate and attach to the nut is your sacroiliac ligaments. So the sacroiliac ligaments, very often, they're getting overly taxed. Remember, in my book, I talk about postural debt. They usually are experiencing excessive debt because we're not properly engaging our inner unit. We're not engaging correctly the inner unit. So every time we walk and we place the leg down and the next leg swinging through, there's an activation of this inner unit that essentially creates that nutcracker effect. It's essentially squeezing the two sides of the pelvis to stabilize the sacroiliac joint, fire off all these muscles that are much larger than just these wee sacroiliac ligaments at the base here. So if we're trying to optimize the stability of the pelvis and we're trying to reduce pressure buildup in the lower back and reduce low back pain, hip pain, pelvic pain, especially sacroiliac pain, we have to consider a way to alleviate that and retrain that inner unit. And one of the ways to do that is what I'm sharing with you this week. I've put my YouTube link below in the description. It's there as a resource for you. And I'm teaching you what is called as the Donttini Mobilization for the SI joint. Now, Richard Donttini is one of the leading experts in this area. Again, I've posted his information down below in the description for you. I've also shared Paul Chek's information where you can kind of follow his blog and some more information, especially for any health professionals that may be watching this. Highly recommend any of Paul Chek's programs and information that he's sharing. The important things, and I'm not going to spend too much time right now teaching you that exercise, that's the purpose of the video and the link below, is there's two things I want you to understand. When you do this particular mobility is the pressure that you're applying with the foot, that you're mobilizing that side of the pelvis. So let's say we're mobilizing the right side of your SI or lower back. When you place the right foot onto the ground and you're applying that pressure, and I talk about it in the video, but I'm just reiterating for you here, is it's just a small amount of pressure, because if you apply too much pressure, you're going to engage too many muscles and you're not going to create that nutcracker effect. So the pressure that we're talking about is, as Paul Chek describes, a marshmallow pressure. Imagine trying to squash a marshmallow. That won't take much pressure. And in fact, Paul Chek shares that there's some research done. It talks about it only takes 6 pounds of pressure to stabilize the SI joint. So we're not applying much pressure to create this effect. And then we put 5 seconds of engagement followed by 5 seconds of complete disengagement. We have to make sure we're relaxing in between so we can retrain this inner unit and fire off the muscles in the correct sequence and provide greater stability to the pelvis. Thank you very much for joining me today. I hope you found that of benefit. If you have, please share it. Just forward this video, forward the podcast, Post it in your social media with a picture of what you've listened to today. And also, I'm going to highly recommend go to my website. If you've not had a chance yet, go download a free digital copy of my new book, The 15-Step Playbook for Pain Relief. I'm really excited. I'm actually building a program around this very philosophy. My philosophy is this: your 4 health controls, your mind, your body, your foods, your recovery. Those are things well within your control. You know your body better than anybody else does. We have to become our own investigator. We have to take complete accountability, direction for our health program. And this is a guideline for you. It's a playbook because it's short, it's sweet, it's condensed, it's getting to the core of information that I've summarized together for you with my 20 years of experience in the health, the fitness, and the wellness industry. So please go download that book. You can get it straight away, sent to your email. If you prefer the physical copy, just go to Amazon and search up the 15-Step Playbook for Pain Relief. I'm going to zip it. Thank you very much for joining me. And remember, your muscle health is my #1 priority. I'm here to serve you. Please let me know if you have any feedback, any comments. Leave